Well, welcome everybody. Doctor, I'm glad you could be on. I know that I'm sure that your life is quite busy right now, and so I appreciate you taking the time to be on with us today.
Yeah, I'm glad to be here.
Yeah, it should be solid. We'll have some more folks come on. One of the things we really like to do as folks do join us or come in and come out is we'll have this recorded, and so we'll put it up on social media. So if anybody wants to share it or refer to it, this is a part of our Foundations of Wellness program, and this really allows us to be able to connect folks to folks like Dr. Jason Onarecker and others in the community who are doing really good work. And we just want to see what offerings we can promote through this and folks we can connect to resources that maybe they wouldn't otherwise, or maybe it's an additional resource. And especially with everything going on in this climate, we just wanted to find a way we could connect folks to a wise mind. And so I really do appreciate you being on, Dr. Onorecker. I know, like I had said, there's so many things happening these days. But I appreciate everybody else tuning in. If anybody wants to share this or has questions or anything of the sort, please ask them. Dr. Onorecker is a pediatrician at SSM Health, and small world how we got connected, but I'm super excited to hear from him. At the Lynn Institute, we do a lot of work with vulnerable populations. And so we really want to see a healthier Oklahoma. And so we work with partners like SSM Health. I see some partners over at OSU Extension Office and others to pull resources to parts of our community in our state that don't quite have access to those resources. And so we do a lot of work in Northeast Oklahoma City and even in looking to get engaged in South Oklahoma City. And so we're eager to continue to try to find opportunities like this. So if you or anybody would be interested in doing something of this sort, I think maybe there might be ways we could find other opportunities to get folks plugged into direct resources, but we'd love to see this continue. So with that, I'll pipe down and welcome once again, welcome everybody. But with that, Dr. Unrecker, I'm eager to hear and learn and see as it relates to back to school health.
Yeah,
It's a little bit different these days. We're in the midst of a pandemic, right? So I know that that's on our minds, but also just generally speaking, as we look at this unique school year we're stepping into, what are just some things we could be mindful of and really be intentional about to make sure that we're putting the health of our children kind of at the forefront?
yeah. So like you said, my name is Jason Onarecker. I'm a pediatrician with SSM Health. Our clinic is here at Covell and I-35. It's pretty new. It's only been up a few months. And so we're just kind of getting the word out there that we have of availability here. And so I do pediatrics here Monday through Friday. We have two family medicine doctors who also see patients Monday through Friday. And we're just kind of getting things spun up here in the kind of the East Edmond area. But I trained at the OU Children's Hospital downtown in pediatrics. And I have two of my own little kids. So my wife is Lindsay. My two girls are Brecklin is 4 and Piper is 2 years old. And they have taught me more than I ever wanted to know about pediatrics and taking care of kids and things that I would never have understood had I not had my own kids. So it's nice to be here and talk with you guys. And I do have, I've been trying to keep up with all the information about what's going on with the pandemic, how it's affecting kids' health in lots of different ways. And essentially there's not just one pandemic. There are multiple pandemics. One of them is a virus, and the others are kind of all the cascading effects of how the virus has affected our lives and changed how things happen in school and how kids are developing and growing up. And so those are kind of some of the things I'd like to talk about. And I see Dr. Foreman on there, and he's the father of a close friend of mine for a lot of my childhood, and it's nice to see a familiar face. So The first thing to talk about is kind of the new trend recently is this obviously we can't go too far without just touching base and updating on how COVID is affecting things right now. And this Delta variant, this new version of COVID has really taken the forefront, and there are a lot of people in kind of the upper levels of infectious disease and public health who are really scared about this new variant. But the way we fight fear is with knowledge and information. And so the things we know now and the things that I've heard and read about this Delta variant are that it's much more contagious than previous versions of the virus. So whereas previously with early versions of the virus, you'd have one person get sick and that person would infect 2 to 3 other people with the virus. Now with this variant, you have one person sick with COVID and that person is infecting 6 other people with the virus. And the reason for that is it's replicating, it's making a lot more of the virus in the people who are catching the infection a lot more quickly. So before you are even starting to develop symptoms, you've got a lot more of that virus in your nose and in your body, and then you're able to spread it a lot more quickly. The early reports were that the Delta variant was not as severe, or it wasn't more severe than early versions of the virus, but I think they're also finding out that because the virus grows so rapidly, it's also causing more severe illness, but primarily in people who are not getting vaccinated. So one of the biggest ways to keep everyone safe right now is getting one of these vaccinations, and it doesn't matter which one; any of them are effective. They've done a lot of studies. There's lots of fear about the vaccines because they're so new, and a lot of the people who are telling everyone to get vaccinated are people who have kind of abused the trust of the public in general, and so there's a lot of mistrust there. But in my experience and everything I've read and come across, the vaccines have still, after all this time, and roughly, I think worldwide, roughly 4 billion doses of vaccine have been given out, which is incredible. About half the population of our country has been vaccinated. And so we've had enough vaccines go out now that we've been able to detect even small amounts of very rare side effects, like sometimes the heart inflammation that occurs with young boys. Some people end up with blood clots. Those are things that are very rare, but we've detected them because we've given out so many doses of this vaccine. There still are challenges brought up about, well, we don't know long-term side effects of the COVID vaccines, so I really still don't feel comfortable. But my challenge there is we also have questions about long-term effects of the COVID virus itself. And because this Delta variant is so infectious, at this point, it's either you are going to get eventually the COVID virus and get the infection, or you will get the vaccine. Those are really the only two eventual outcomes for pretty much everyone. And so if you have major concerns about long-term effects of the vaccine, well, we have pretty significant concerns about the long-term effects of getting the virus and having the infection as well. So in my experience and everything I've come across, the virus is still much scarier than any of the unknowns about these vaccines. So I do encourage everyone to get vaccinated. Everyone who's eligible at this point, 12 years old and up. They're doing more studies on the younger kids, but we can talk about that here in a minute because it's different for these younger individuals. So with COVID now, we do in this upcoming season, we do have other health concerns, other infections. So with kids in particular, RSV has actually spiked up in the middle of the summer, which is odd. We don't see that usually. It's a winter virus. We have very predictable patterns of when RSV, which is respiratory syncytial virus, we have very predictable patterns of when that pops up, when we can expect it to start affecting kids. And now it's showing up in June and July, which is crazy. And so we have a lot of concerns about that as well. And now it's kind of throwing off everyone's expectations about what will happen in the fall when, in a couple of weeks, really, when school starts up, what's going to happen when flu season hits. So RSV is something that is pretty serious for kids who are 2 years old and younger. It can cause pretty severe respiratory infections for those age groups. Kids who are older than 2 years, and the older you get, the more RSV just looks like a regular cold. There are probably kids 5 years old and older. Adults get RSV all the time, but it just looks like a cold and you get better. Kids who are younger than 2, those kids often end up in the hospital really sick. And so those are the ones who are most vulnerable. And so it's hard to have some conversations with parents who have age groups, younger infants who are deciding at this point, like, do I put my kids in daycare right now, or do I try to make it work and delay my kids going to daycare until we know more about why RSV is still so prevalent right now? And those are hard recommendations. There's not an easy answer to that question, but I can say the younger your child is, the more at risk they are for severe disease from RSV. And as far as flu goes, we don't know what to expect. This last flu season, we had very little flu, almost non-existent. All the public health officials would still recommend this coming season still absolutely get flu shots, because we don't know what to expect, and you don't want the problem of a flu epidemic on top of a COVID pandemic in the future. So the more protection you can offer yourself, the better. I'm trying to refer back to my notes. I wanted to make sure and not miss talking about things that I was planning on talking about. So this coming school season is going to be tricky, because now we have the Delta variant that's more infectious, and everyone's worried about what are we going to do in school. The Academy of Pediatrics and the CDC are both recommending in-person schooling for all ages, because the benefits of that far outweigh the risks. And they did lots of studies and research throughout this last school year to see what the risks were, how COVID affects younger people. And they felt like by far keeping kids out of school or modifying school to the degree that it's ineffective is going to have much worse long-term outcomes than just doing in-person school and then trying to adjust and keep kids as safe as you can. Because overall, the younger kids are, the less vulnerable they are to COVID. So in your 5 and younger age groups, they're very safe from COVID in general. The rates of COVID in those age groups is very low, and when they do get COVID, they often get very mild disease. So parents of young school age kids can feel confident that their kids can go back to school, and hopefully the school will be implementing some precautions and taking some measures to make sure that they can limit any transmission of the virus. But overall, kids are very safe from COVID. But one kind of comparison I like to make is the chances of a child dying from COVID are roughly equivalent to the chances of anyone getting struck by lightning. Maybe not quite that rare, but pretty close. But even for something that rare, it's not like during a thunderstorm we go out swimming or we go stand next to trees in the middle of a thunderstorm. Even something that's rare, you still take your efforts and measures to limit your exposure to those things. So if you're saying, well, it's rare, it doesn't happen in kids very often, it's like, well, yeah, but it doesn't hurt to be safe. We don't take unnecessary risks, even if things are rare. And so there are still kids that get COVID. There are still kids that die from COVID. It's not very often, it's very infrequent, but that one kid was someone's child, and that person also thought, this is very rare, it doesn't happen to very many kids. Well, it does to some, and it did to that child. So it still is important to take the precautions that we can, and they are recommending masking for kids who are older than 2 years old in school. I think it's reasonable. I think masking does inhibit some of the development of children, especially language and social development. And so I don't think it's something that we should maintain for any longer than necessary. But it just is another safety measure to take to make sure that kids are staying safe.
We've got a question for you if you don't mind taking it, Dr. Onarecker. This is from Rachel. She asks, with the people she knows and their young children getting RSV and hand, foot, and mouth, are there any things that they can do to combat it, or try to overcome it with how rampant it is?
Um, Now, these are hard because these are two very contagious viruses. And so hand, foot, and mouth is a virus where you get sores in your mouth and then on your hands and feet, obviously. But then in younger kids, it's a lot of times in the diaper area. And so the worst thing that happens from this is the sores in the mouth hurt so bad that kids won't eat or drink. So you have kids coming to the hospital and the parents are saying, my 1-year-old won't drink anything. And it's like, it's an impossible struggle. And so that one can be rough. The things that you can do to try to prevent those from occurring in your children is start teaching kids at a young age the normal hygiene routines. So washing hands, start making that part of your very normal routines, because a lot of this is hands to mouth and hands to face. That's how things get transmitted. So if you can teach kids from early ages, make hand washing a game of some kind. Start singing songs during hand wash time. Make it part of morning meal routines. Anytime you've finished playing with toys that are kind of a huge source of infection, start incorporating those hygiene things into your routine for your kids at even very young ages, because the things that become normal for them as they grow up and get older are the things that you started teaching and incorporating at ages where they didn't know any better. They had no idea that mom was setting up my routines, my health routines, when I became a teenager, when I was a 1-year-old, and starting to teach them how to wash hands. But those are the biggest sources of infection are dirty hands, dirty toys, phones. So phones are a huge source of infection. Tablets, and 1-year-olds aren't on their phones very often, but parents are, and parents can spread those infections just as much. So your phone, this thing is basically just a big virus container, and the more you interact with it, the more it's going to start spreading viruses around to your spouses or your kids or pretty much anyone. So be aware of where the infections come from, and target those high risk things, which is clean hands, phones, tablets, anything that these hands are getting in touch with are going to start spreading that virus around. And also, I do encourage parents, when your kids are starting to show symptoms of getting sick, it is the right thing to do to try to figure out, and this is very difficult, but trying to figure out how you can keep your kids home from your daycare when they're starting to have symptoms. Because so many parents are like, I have to go to work. I can't stay home. We both work. What am I supposed to do? And in those cases, it's a very difficult choice to make. And you do feel like, well, kids they have snotty noses 8 months out of the year. How am I supposed to keep my kids home from daycare? Well, if at any time in your life of parenting, you decided it was a good thing to do to try to keep the kid with a snotty nose home from daycare instead of sending them, this is probably one of those times. Now that hand, foot, and mouth, RSV, and COVID are things that are affecting our lives to this degree, maybe your threshold for keeping your kid home instead of sending them to daycare is a little bit lower, in an effort to try to limit the spread of these viruses. Does that answer the question?
Yeah, I think so. Thank you for that answer.
Good. The other things that I really wanted to touch on are some of the I call them kind of the silent pandemics of COVID, and they are largely the result of very restricted medical care and health care. Usually parents are taking their kids into the doctor several times a year, or at least once a year once they're getting to the school ages. But now during COVID, kids are not coming to the doctor. They've skipped immunizations. They've skipped these wellness visits. Even in school, you get a lot of interactions with teachers who have some training recognizing normal development in kids, and those interactions have been very limited. And so the safety stops, those touch points of evaluating kids growing up to be healthy adults, those have been very restricted as the pandemic has gone on, and it's starting to have those cascading effects, those silent pandemics. And so we can go through a few of those things. And one of the important ones is immunizations. So kids get shots fairly frequently up until about 4 to 6 years old. And then even when they get to 11 years old, there's another round of shots. And then teenagers get a couple more shots as well. And those are important things that our future selves will be mad at our current selves if we are not getting our kids the routine health maintenance items that keep them safe in the future. So, if we start coming up with, pertussis and measles pandemics in a few years from now, we will know where this came from. And it's because during the COVID pandemic, everyone sacrificed future health for current health because they were afraid to come to the doctor. So it's important to get kids their routine immunizations. We do at all these clinics, and I'm here at mine, and you can see our nice clinic here. We take steps to limit exposures here, and I have my mask on in the lobby because it's completely empty right now, but otherwise I would be wearing my mask. I would be taking steps to make sure that people who are sick are affecting the rest of the people here to the least degree possible. And they do that at most clinics. So it is safe to bring in kids to get their shots, and it's important to do that. The second thing is mental health. So it's another huge pandemic that's developed during COVID. The mental stress that has been a result of the way this pandemic has affected society has started to bring up, it's like bubbling to the surface, all these mental health issues that were kind of simmering or sitting just below the surface before COVID. So you've had things like anxiety, depression. Those are the biggest two. They're starting to pop up and become huge problems. And in parents, so I always say that the health of kids really depends a whole lot on the health of their parents. So if you have parents who are developing this anxiety and this depression, and they're letting it go, they're not addressing it because they feel like, oh, this is just normal stress that normal parents go through. I don't need help. I don't need medicine. I'm just going to kind of power through it. Well, that's just silly. It is a disservice to yourself to ignore mental health as a big part of your overall health. And so if you are developing anxious feelings, anxieties, days of sadness, or completely lost interest in doing things that you were enjoying previously, then talk to your doctor or talk to a counselor. Start talking to someone about these problems because they are things that can be addressed. And it doesn't have to be medication. For those who are really not supportive of some of these psychiatric medications, go talk to someone who is trained to be able to talk back to you and give you skills and coping mechanisms that are healthy and teaching you how to deal with some of these mental health issues, because this is not normal life that we're living through. There is a lot of stress added to our lives these days, and it's bringing up all these mental health issues that we just don't have to be dealing with as much as we are. So there are people who can help with those things, and there are medications that can help for those who are open to that. And it's not okay to ignore those things, and it's not okay to ignore mental health issues for the kids either, because I'm starting to see it in my clinic. I'm starting to see anxiety become a big deal. I'm starting to see younger teenagers more frequently showing signs of depression. And parents are now realizing this, and they're realizing that I need to do something about this. This is affecting my daughter so much that it's affecting her schooling. So she's not able to function in school as well. She's really withdrawn socially because of her new anxieties, and so kids are even developing weird specific phobias to different things because of the kind of this projected fear of adults and the news and social media of the pandemic, and all the fear and stress it projects onto those kids, even if they don't fully understand why or what's happening. They do get the emotional stress that comes with that, and so they are developing a lot of these mental health issues throughout this pandemic, and it's becoming a big deal. So it's not smart to ignore those problems. It's wise to recognize issues early. So if you're noticing that your child at any age, your child is withdrawing from the family, withdrawing from their friends, and starting to have emotionally, they feel like they seem like they're emotional roller coasters more so than they were previously. They're having a lot more negative interactions with parents and their siblings. You can't always recognize what anxiety looks like in a 9-year-old until you start asking the right questions. And trained health experts know the right questions to ask to kind of bring these things out and start teasing out what's going on. So it's another reason to be aware of those things and start getting checked in on. How much time do we have?
Yeah, you're good. You're golden on time. Yeah, you're good. We could 15, 10, 5, really whatever works for you. We such a rich bit of information.
Good. I want to respect everyone's time that's participating. So I probably got 10 minutes or so of things to talk about. I probably could talk for another 30 minutes because I'm getting up on a soapbox now, but I can probably pare it down a little bit.
No, you're doing great.
So another issue that's kind of popped up during the pandemic that I try to talk to parents about is development. So normal development, and kind of tied in with that is the way that screen time, is what pediatricians call it. Screen time has started to affect development in the lives of most younger children, especially, but also teenagers, and then adults in a lot of ways. So through the pandemic, people have gone through these lockdowns. They're stuck in their homes. They can't go out and do the normal things. They can't even see family members. They've relaxed most of those restrictions, but for a long time, it was stuck at home for months on end. And because of that, parents kind of went into survival mode. They transitioned from a nice routine at home where, okay, you get 30 minutes of screen time on your tablet before dinner, and then you can have another 1 hour of screen time after dinner, and then we have to turn it off an hour before bedtime. They went from these nice, good, regimented routines to all limits are off, screen time whenever you want it. This is survival measures to try to compensate for not being free to go out and do normal things and go to the pool and go to movies. Now I guess movies are more screen time, right? But we can't do the normal things. And so instead of those things, we're just going to let kids watch as much TV, as much of their tablet as they want. They can play video games for 8 hours a day. And I think they're starting to come out with research now. There will be a lot more in the future about how the increase of screen time, especially for younger kids, is starting to really affect their development in many ways. It's not a good thing. So limited amounts. So they've done a couple of big studies that show if you limit screen time to for ages 5 to 17 is the age they did these studies. But if you limit screen time to 2 hours or less, if you are able to get 60 minutes of exercise and activity, moderate to high exercise, And if you are able to get 9 to 11 hours of sleep between those hours at night, then it matches up with much lower rates of obesity, much higher quality of life, and much lower rates of negative impulsive behaviors. So kids who are, I feel like any kid between the age of 2 and 7 has some level of ADHD just naturally because of how they are at those ages. But you have a lot of impulsive behaviors at those ages. And once it crosses a certain threshold, we start calling it ADHD for kids who have lower attention spans and higher amounts of hyperactivity. We start diagnosing ADHD, but even kids who are not at the threshold but have a lot of those things, if you can get that 2 hours less screen time, 60 minutes of physical activity, and at least 9 hours of sleep at night, your problems that are associated with ADHD and hyperactivity and impulsive behaviors start decreasing dramatically. And so that's one of the biggest messages that we preach as pediatricians for parents of kids in those age groups, specifically in developmental areas, is if you can limit screen time to 2 hours in a day and start getting exercise and sleep, which is common sense for everybody, but when you start putting it into actual data and actual studies, and then start showing actual correlations with huge significant improvements in a lot of the health of those age groups, then it starts to make it more real. And you start to think, okay, maybe there is something to this. It's not just my common sense telling me that, yeah, we should probably get exercise. Now we have numbers, we have data. They've done studies for long periods of time and that are ongoing now that show that if you can do those things, you have much better health outcomes. Specifically with teenagers and social media and electronics, the issues that are becoming more and more prevalent have to do with their social development and the effects on really the mental health of teenagers who are starting to be on their phones for hours and hours a day. And so they've done some studies that connect social media use in teenagers to mental health issues like anorexia, depression, anxiety, and there's a huge connection. A lot of it comes from specifically because there are healthy ways to use social media, and there is actually to use limited amounts of social media is actually a healthy thing for teenagers if they can do it, if they can use it in a healthy way. But teenagers, social media has become almost like the drug of choice for teenagers, and they use it to compare themselves in images of themselves compared to the things that their friends are posting. The more social comparisons that are happening, both with physical body image and with financial situations and opportunities like travel and popularity, like you throw all those things into the social media mix with these teenagers, and now you're starting to get another huge issue with the development of depression and major body image issues for those age groups. And I hate seeing it because you want to, being a teenager is hard enough as it is. Growing up with hormones just constantly in turmoil, and your body and your expectations, all this development is happening before you really have the mental capacity and the mental development to start making good choices with all of it. So to see teenagers who are growing up with social media affecting their happiness and affecting the way they view their own bodies and the way they view their popularity in a negative way is really hard to see. And the only way to combat it is to start to raise the awareness of it and start teaching teenagers to recognize those things, because they don't, all they see is the social pressure of being involved and participating in social media in those ways, and they're not able to recognize the negative effects it has on them. Once they start developing legitimate depression and anxiety and anorexia, they start to understand, because now it's become real and this is really affecting my health. And so now I can see why this is a problem. But the goal is to try to intervene and teach those things before it becomes a problem. So you can start teaching teenagers normal self-control and how to use social media and use electronics in healthy ways instead of letting those things use them. And so I think because of the pandemic, the way it's affected our lives, our day-to-day interactions, it's pushed social media to an even more prominent place, to become an even bigger part of the day-to-day lives of teenagers. And all these things are affecting adults in hugely negative ways as well. But adults are old enough to start making, they should be able to make their own choices and recognize those things for themselves. But kids are still at an age where they really need input from someone who can teach them the right way to use these things. If you wait till they're 14, 15 years old to start teaching them the right way to use social media and electronics, it's already too late. They've already developed their own desires and patterns for how they want to use those things. And anyone who's raised a teenager or even knows a teenager knows that if you try to tell them what to do with their lives at that age, especially when it comes to their phone and their electronics, you're going to see a huge backlash. So you have to start incorporating this stuff, just like the hand hygiene, teaching kids how to limit infections, teaching them at younger ages healthy ways of interacting with electronics, tablets, phones, social media. That's the only way to start getting ahead of things.
This is wonderful. I really think a lot of the information that we talk about, and I think quite often that's circulated, is about COVID in adults and the way that folks who are fully developed are experiencing things. But it's quite interesting to get this perspective as to these same issues that we quite often talk about affecting adults, how it affects children, young children, and you're right, during the pandemic, it's so easy to throw that iPad, here, go, it's so easy to go get distracted over there, right?
Do it in my house.
Right. Yeah. Right. It happens quite often, right? We've got those movies that, sit on replay, right? A question I have, this is a broad question, and there's not three things, there's four things. But as we look at this jump going from being isolated potentially, or at home, or whatever the case may be, to now going back to, in a lot of ways, a pre-COVID schedule, maybe with school, if there were a few things that you said, whether it's with health, mental health, physical health, whatever, if there were just some things that you might recommend, generally speaking, maybe you don't have any that are that specific.
Like big, high value takeaways for some of the main issues.
Yeah. I think to point folks maybe in the right direction, that it's been a year and a half, 2 years close. What are these things that I need to just be mindful of that might not change everything, but might help with some baseline, getting back into the rhythm?
I think one big change, and I think we probably need to do it in my house. I think having designated times, designated times in the house with the family, all together, and this is usually like dinner, and having a time where you all are together for dinner, and it's electronics free zone. So everyone takes whatever phone, tablet they have. They all put it off in one spot. No one touches things. You can put it in a cabinet or whatever, and you don't touch it, and you just leave it there for an hour so that you and your family can sit down and eat dinner together and just talk to each other, which sounds crazy for some people. Just sit down, eat dinner together, and talk with your family and have normal conversations. Those are the times when some of these issues start coming out and kids start mentioning things. Or you have a designated time to start asking them questions that are specific about their friends and the stuff that goes on in TikTok and Instagram that they don't want to tell their parents about. But if you make this time, and then you're going to get backlash on this, but if you start creating the atmosphere in your home where in the evenings for dinner we get together, sit down, eat dinner together, and our electronics get put away, and you can, the longer you can do it the better. But if you just put it at an hour, and it'll feel like the worst torture in the world for that 12-year-old. But if you can tell them, if you can put your phone, like, this is the rule and we're all going to do it, your parents are going to do it, because parents are just as addicted to their phones as the kids. Your parents are going to do it. They're going to put their phones in that cabinet, and you're going to put your phone in that cabinet, and we're not going to touch it for an hour. And you got to sit down at this table and eat dinner with your family. If that first night you sit down and your 12-year-old is in rebellion and they decide they're going to sit down and not talk for an hour of dinner, fine, let them do it. They can do it. How long can they hold out? Are they going to not talk at dinner for the next 3 weeks? Eventually, they're going to realize that they might as well just jump in, talk to their parents, check in, see how things are going, start letting some of these issues bubble to the surface that are being hidden because all this interaction is limited, and start restoring some of that family interaction. I think that's a big one, and it hits on a few different things. So it hits on the screen time and the electronics, which is a big deal, and starting to put practical measures in place to limit that screen time for all ages. And it increases the face-to-face time between parents and kids and the siblings, which starts to bring to light and increase awareness of some of these other problems that we're seeing. So some of the mental health issues, some of the developmental problems that you might notice for the younger kids. So at 2 years old, your child should have a pretty robust vocabulary and should be speaking in 2 to 3 word sentences. And if you're noticing now that the husband is noticing, well, like, wait, our 2-year-old doesn't have normal speech. Like, I didn't realize this because we're always running around doing crazy stuff and not interacting with our family. And now I'm noticing that our young children have some developmental delays that we can start working on and that we can fix. But it just creates this atmosphere where some of these other issues that are associated with the pandemic start to come to the surface and become more apparent, because you're just increasing that face-to-face time, that personal interaction with your families. And for the parents who stay at home with their kids, this part of it isn't probably, as big of a deal, because they spend all day with their kids a lot of days. And my hat goes off to the parents who have, throughout this pandemic, have become teachers and the daycare providers for their kids. They've quit work so that they can stay in with kids, and it is harder than whatever job they quit. Staying home with their parents and being a full-time parent 24 hours a day is very difficult. But this is something for once they get older, the school age and teenage years, increasing that face-to-face time is really the only way to start recognizing some of these other problems. So that's a big one, just a very practical thing you can put in place.
Yeah, no, I think that's gold. And it's well, it shouldn't be. It is quite comical that since things have little things have been happening, going to a meeting here, a meeting there. It's almost like we're having to retrain ourselves, right? This is what normal human interaction is,
Yeah.
right? But no, I think this is wonderful. And I think that really at the root of what you're saying is creating these spaces where you can be aware and you can be intentional and
Yeah.
look into these things. And as a parent, what is it? I saw this quote that one time: is if a parent's ever questioning whether or not they're being a good parent, only good parents ask
Right.
themselves that, right? So I really do, to your point, to the mothers and fathers that during this entire pandemic have been home with their children. Keep fighting the good fight and keep doing it. But Dr. Onorecker, I really appreciate you taking time to be on with us today. This is a wealth of knowledge, and I wish you the best of luck. By any chance, right now, if anybody's looking for a new doctor for their family, are you accepting any new patients at this time as far as
Uh,
your schedule?
yeah. So it was really nice to come on here, and one of my favorite parts about being a pediatrician is the getting to talk with parents, getting to teach. Basically, my goal would be to teach parents to be the health experts for their kids, which almost feels self-defeating. Like, if I make you the expert, then what good am I? But I really do want parents to be aware and have the knowledge that they need to be the health experts for their own kids. And so I like teaching these things. I went to school for a long time. I might as well use a lot of the stuff that I got for that time. So I really do enjoy this a lot, and I'm glad I had the opportunity to come talk to the people who could be involved today. But yeah, so our clinic is pretty new here at Covell and I-35, and so it means we're still building. We're still filling up our schedules, and there's a lot of availability left here. So every single day this week, I have availability to see kids of all ages up to 18 years old. We also have the family medicine doctors who see all ages, mostly adults. But yeah, I've got lots of availability, and I really enjoy taking care of your kids. We also have the urgent care is attached to our primary care offices here. It's all one building, so we have one side that's primary care, one side that's urgent care. So I've had a lot of parents who they have their own pediatrician. They go see them for well visits and stuff, but this clinic is so close to where they live that they come here for urgent care visits occasionally. And then it's almost like having their secondary doctor. So they have their primary pediatrician that they go see, and then whenever they need an urgent care, their kid gets sick and their main pediatrician can't see them, they come stop in here and see me, and then they can. One of the problems with urgent cares is every time you go to a different one, you go see a different doctor, and then it's like no one has any idea what your health history is for your child. And so if you can limit to as few doctors as possible taking care of your kid, then that person knows their history, they know your preferences, and they know what kind of health goals you have for your family, and they can work with you on all those things. So if they have their own pediatrician that they go to for most things, but then they come to see me for the urgent care stuff, then I still am someone who knows their health history and their preferences, and I can work with them. So
If someone is interested, what's the best way for them to get in your inbox or your voicemail or things of that nature?
yeah, so we have our clinic here is the phone number is 405-772-4130. I guess you can type that in the chat over there.
Yeah, and that was 405-772-4130.
0.
All right, did I get that correct?
That's it.
All right, yeah, no, that's wonderful.
So that's the best way. That gets you in touch with Jackie. She's the lady that answered the phones here. She's a sweet old German lady who likes talking to people and working with the schedules and getting people on here. And if anyone here needs to get in touch with me directly, you can always call that number and say, hey, I was hoping I could get a chance to talk to Dr. Onorecker, and she can send me a little message and say, hey, someone was trying to get in touch with you, and then I can give you a call back.
That sounds great. Once again, Dr. Onorecker, thank you so much for being on with us. Thank you to everybody who was able to hop on with us today. Like I had mentioned, we'll put this together and share it on social media. So if there's anything if there's anybody you want to share it with, or anything you want to refer back to, we really appreciate folks like Dr. Onorecker who take time out of their day to hop on, just to share tidbits of information that in in this information-rich age that we live in, it's refreshing at times just to be able to go straight to a source and just get information without a spin, without just to get the raw information to best live our lives. So with that, thank you, Dr. Onarecker. Thank everybody else, and I wish you guys a healthy week as you guys go on.
Thank you so
Thank
much.
you, Jason. Good to see you in person.
Yeah, good to see you too. Thanks
Thank you.
everybody for joining us. It was very welcome opportunity. So
You guys take care.
see everybody.